With IVF treatment at the forefront of fertility care, there has been an increasing concern for its ethicality. Whether it be through a religious conflict of its unnatural state or its costly nature, IVF's ethical and social implications will today be discussed. What exactly is IVF? IVF is an invasive medical technique involving the joining of an egg and sperm outside the body to assist in the conception of a child. IVF is a specific treatment that requires close coordination with fertility specialists, experienced nurses, scientists, and counselors for fertility care. This fertilized egg or embryo is incubated in a safe environment prior to transferal into the uterus. With successful implementation, the woman would then fall pregnant. The probability of a healthy, normal baby using IVF procedures is dependent on a variety of factors, including age, cause of infertility, and more. Who is IVF for? IVF is used to overcome a range of fertility issues. For many couples, gives them the best chance of having a baby. IVF is the primary mode of fertility treatment for women over the age of 40 or those with specific health issues. Below are some of the main motivations for IVF. Male partners who may possess sperm with poor mobility, low sperm concentration, or irregularities in shape or size. Women with fallopian tube obstruction or damage resulting in an inability for the embryo to travel towards the uterus. Individuals with certain unwanted genetic disorders with high risk of being passed on to offspring, as well as women with endometriosis. Safety and risks. Despite being an invasive technique, IVF is a generally safe procedure with little health or pregnancy implications. However, there are risks involved, including ectopic pregnancy, which is the implementation of a fertilized egg outside the womb which cannot support the growth of a baby, multiple pregnancy and/or birth that can be unwanted or harmful to the mother, birth abnormalities or defects, most commonly heart issues and defects of the urogenital tract, as well as the ovarian hyperstimulation syndrome, a reaction to fertility drugs that are prescribed for women in IVF to increase egg production.
Efficacy and success rates of IVF vary widely, especially with age. It's also been found that during the mechanical process of IVF, the duration of embryo transfer, number of oocytes obtained, and the number of transferred embryos all influence pregnancy success too. Failed pregnancies increased when embryo transfer occurred over duration longer than 60 seconds. It's also been found that the use of ultrasound to guide embryo transfer has improved clinical pregnancy and implantation rates. In success rates achieved by IVF Australia, it's evident that frozen embryos yield much higher success rates for women over 40 than fresh ones, whilst the difference is negligible for those under 40. Community approval rates have increased dramatically since the 1980s, however there was still a significant disparity between various IVF users.
Starting a family is very important to many people. However, infertility may come in the way of this dream and has resulted in a decrease in reproductive rates. IVF is seen as a helping hand in conception, but the cost behind IVF doesn't allow it to be accessible to many. In Australia, one IVF cycle can cost up to $10,000 and over. Some of these costs is rebatable under the Australian healthcare system Medicare. However, it's still very expensive for many families. It is not ethically acceptable that only individuals who are wealthy enough can undergo IVF while many can't. Another ethical issue is the fate of the embryos that are not used in implantation. Embryos that are not implanted into the mother's uterus are either stored at a cost of freezing the embryo or destroyed. Many people debate that the destruction of these embryos is unethical as it could have potentially been a child. One of the main ethical issues of IVF is the concept of technological interference with natural selection and the natural process of conception. The question is, how far will technology reach if we allow it to control the simplest biological methods? Through IVF, parents can choose the gender of the embryo implanted, and advancements in technology have even allowed scientists to change or emit parts of the embryo's DNA. Despite the advantages it may have, many see this as an unethical issue.
Advancements in the world of IVF all aim to achieve the same thing: improve success rates in patients. This is mostly achieved through the use of digital technology. This can allow for more specific incubation and medium environments to provide optimal gamete and embryo storage. Cell selection is also possible and advancing along with pre-implantation screening to eliminate heritable diseases. Embryo glue supports attachment of the embryo to the mother's uterus. IVF technology is also being utilized to develop sperm robots for drug delivery in cancer patients, along with preservation of endangered species such as the northern white rhino. Overall, IVF provides real opportunity for those struggling to overcome fertility issues. Despite ethical concerns surrounding its nature, this technology has given life to over 8 million people since its development.